relation and outreach. Okay. Okay. Ahmed Al-Aqad, Dr. Ahmed Al-Aqad, he is an Egyptian pharmacy student in the Faculty of Pharmacy, Paris University in Alexandria. An IVPN students leader, IVPN mentor board member. Ahmed served as a chair of external relation and outreach in IVPN students and vice head of social committee in Paris Pharmacy Students Union. Founder of Shabab Wa'i initiatives, supported by UNICEF and Ministry of Youth and Sports of Egypt, which aim to raise awareness against COVID-19 in addition to being a volunteer in Ministry of Youth and Sport of Egypt. Member in Alexandria Youth Parliament and internship trainee at Al Hikma Pharmaceutical and Eva Pharma. So Dr. Ahmed Al-Aqad, the floor is yours.
Okay, and really thank you very much for your grateful introduction. Hello everyone, thank you for your attending today in our orientation session to introduce you and listen to all questions regarding this competition. I would like to thank all the universities and all the pharmacy student associations who support this competition. I am sure it will be a great opportunity for you and us to develop our skills in patient counseling competition. As you know, that's one of the most important duties toward the patient to achieve our goal as a future pharmacist or a pharmacist in improving patient health as a caregiver. But before I will share my screen, I would like to ask you something that I think it will be a great opportunity for all of us as students. As many of us as students asking small questions before graduation. So what will I do after graduation? So what will happen? Will I be in a community pharmacist, or will I be a hospital pharmacist, or even a pharmacist in a pharmaceutical company or a pharmaceutical industry? We don't know that really yet. We are doing our best to discover with each other. So, but now you have a good opportunity to meet experts from different countries, from different regions all over the world. Buy your free and membership in IVPN student listserv, and you can be a member in IVPN network that you can develop your skills and achieve many things by your free registration in IVPN network. So also this opportunity that if you are also passionate in something related to the pharmacy careers like oncology or clinical research, patient support, and other research that you see that it will be a great addition to you in the future, and you will be this is your career that you are looking forward to after graduation. So you can join this and this list serves and be a member in this. So please, can I share my screen with you? Can you see my screen?
Yes, we can see it here.
Okay, very good. So actually, as you know, that IVPN network created by Dr. Osama Tabbara from UAE, and also we have a code that always inspiring us, which is we focus on the millennials. We are game changers, as well as other pharmacy students that would like to be not a traditional pharmacist and to do our best to be a well-known pharmacist and have opportunity to do many things that related to your job and achieve one of your common to be a great pharmacist in the future, inshallah. So our story in IVPN, we launched in Atlas listserv in 2012. That main object was transferring knowledge about only IV and parenteral nutrition. But now, especially in 2020, we just have opened many listservs to cover many aspects of pharmacy practice and leadership and research. So let's go to the IVPN student. As you know that it's one of our roles that what's our role in IVPN student and how can I be a member in IVPN student? In IVPN student, we focus on the Generation Z, who is the future of the pharmacy practice, inshallah. So that can influence this can be a great opportunity for Generation Z to develop their skills, as this lecture focus only on the student and how to develop their skills. As also our mission is to discover new talented from students from different countries all over the world to achieve our common goal to be a non-traditional pharmacist. As you know that we are now in develop ourselves, and the age, the time is going, and there is many things that appeared, the automation appeared, and that now we should develop ourselves to be able to do with the new things happening in this time. Also that we are leveraging the exposure of students with pharmacy, with various pharmacy field. That is one of our main issues that also we are asking ourselves, we're asking our teachers and professors in the college. So what is this field talking about? Or am I will be a hospital pharmacist? If I would like to be a hospital pharmacist, what should I do? So many of us would like to go to ask anyone in hospital to see this, or if I would like to join a community pharmacist, or I would like to be in oncology or be a researcher. This will be easier for you if you would like to join IVPN student, as you will see, and you will have opportunity to meet experts from different countries all over the world by your free registration and your free attending. As you know that all IVPN activities, all IVPN student activities are for free for anyone who would like to join. Also, it will be a creative, interactive platform between students and the global pharmacy leaders. I know that we have Dr. Serene with us tonight. We will discuss with each other about the competition and to tell us how should we do in this competition, inshallah. Also, with our main object that we can give the student the floor to ask any question they would like to ask about their career, about their life, about which field they would like to join. So at the end, I would like to give you this my contact email and LinkedIn if you'd like to ask me any relative questions. I'm with you. And this is IVPN network website that also you can visit it and register in any listserv that you would like to join in the future, inshallah. So thank you very much. I'm really happy to be with you, and I am really ready to answer if you have any question you would like to ask me about.
Thank you, Dr. Ahmed. Thank you for your great information about IVPN network, IVPN students network. And I would like to encourage all of you to join IVPN and to never leave this information. It's like from a personal experience with IVPN, so don't miss this chance. Also, I want to ask you if you have any questions for Dr. Ahmed, do type them in the chat box and we will attend to them during the Q&A session. So anyone has any questions, do type it in the chat box. Again, thank you, Dr. Ahmed, for your information. And now I am giving the floor to our next moderator, Michelle. Michelle, now the floor is yours.
Thank you so much, Dua, for the introduction. Hello, everybody. My name is Michelle. I am a third-year pharmacy student from the University of Blida in Algeria. And I'm a member of the IVPN Student Professional Development Committee. As IVPN, we applaud you for taking the bold step in participating in this patient counseling competition and sparing your valuable time for this orientation session. As pharmacists, it is vital for us to understand that having excellent patient counseling expertise is of utmost importance in order to ensure good patient adherence to treatment and to reduce any financial costs or complications that can arise due to non-adherence. We must take an active role in counseling each patient by directly influencing positive outcomes of patient care through education and counseling. Because of this, we created this opportunity for you to enhance your patient counseling skills through this competition. Ladies and gentlemen, let us welcome our second speaker for today, Dr. Serene Shoka. She is a pharmacy graduate from the University of Toledo College of Pharmacy in Ohio 2013. She got her residency training, PGY1, at ProMedica Toledo Hospital and Toledo Children's inpatient acute care setting. She has wide experiences in retail ambulatory care, where she managed anticoagulation clinic services at the University of Toledo Medical. She is currently practicing at Bonsecours Mercy Health, St. Vincent Medical Center as an internal clinical pharmacist. She is providing clinical services as part of a multidisciplinary team. Dr. Serene is a pharmacy student and resident preceptor. Additionally, she is passionate about patient education and transition of care to ensure safe and effective continuation of care and reduce readmission. Dr. Serene is also the leader of IVPN Patient Support Listserv and IVPN podcast and patient counseling competition. Her interest is research, patient education, program development and management, and student development. Wow, I must say this is an amazing bio, Dr. Serene. We are so honored to have you amongst us today. Over to you, Doctor. The floor is yours.
Well, thank you so much, Michelle. I really appreciate this great introduction. I want to thank you all in students, IVPN students. You guys are wonderful examples of future leaders in pharmacy. It is an honor for me to be presented by you and to be part of the presentation today with Dr. Ahmed and everyone, Hafiz and Dua. You guys have done an amazing job. I can't thank you enough. Moving forward, we're going to be talking about the presentation about how to best provide a patient counseling session for the patient counseling competition. That's the main purpose. But we can also use the skills and the topics that we're going to be talking about today for any future any future opportunities that we have with our patients. So let me share my screen. All right. Okay, so the main objective for my presentation today is to hopefully enhance your knowledge about patient counseling and to also improve the problem-solving skills for our students and our new pharmacy practitioners using case-based counseling, and to also help you increase your confidence in providing an effective education session. For the purpose of the competition, hopefully you guys will be winners and meet you more on one-on-one sessions in the future, in the near future, or for your future as a pharmacist. So I would like to give you brief, little bit discussion and in history about patient education and counseling. So why patient education? Why is it important to provide an education for our patients? Basically, it is important to empower our patients with the skills and knowledge that's necessary for them to help achieve the best outcome for their therapy. If you educate your patients, you're actually giving them a chance to overcome any barriers for successful therapy. They will be able to make an educated decision about their health, and it will increase their chance of therapy adherence and better quality of life. You need to know that really patient counseling increases when we increase patient education. So the higher the patient education, or the better patient is well educated, the better the chance for them to be compliant with their medication. Not a surprise, but more than 60% of patients misunderstand instructions for properly taking their prescriptions immediately after their doctor visit. I believe many of you and many of us do have an elderly, or even not even an elderly, but a patient in our family who need help with their medications. And as pharmacists, we can really provide them the best counseling and instructions, especially after a doctor's visit that could be an overwhelming for our patients. If we can provide good patient education, we can actually help in minimizing healthcare costs, because between 100 to 300 billion is avoidable health health costs was actually due to medication non-adherence, hospitalization, and disease progression. So if patients are well educated and have good compliance, we can actually really decrease healthcare costs. It's an important topic that we all need to be aware of, and I always try to talk to my students about is being aware of health literacy. So what is health literacy? Health literacy is not education. So the health literacy is something very important that the CDC extensively talks about. We do have two kinds of health literacy. Personal health literacy, it's where it is the degree to which individuals could find, understand, and use information and services to inform health-related decisions and actions for themselves and for others. And there's another type of health literacy that we also need to be aware of. It's called the organization health literacy. It's where the organization are able to provide individuals with the resources to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Patients with low health literacy, they have higher emergency room visits. They have longer hospital stays. They're less likely to follow treatment plans and higher mortality rates or harm. So we all need to keep that concept in our mind when we're talking to our patients about their medication. To have a good improvement in our patients' individual skills, knowledge, motivation, and action, or to empower them to have control over their health. Actually, it is a multifactorial approach. We all need to know that it's a multidisciplinary, you can say it's a multidisciplinary approach where health information needs to be provided for our patients in written or spoken that's clear to understand, where they can develop information alongside to ensure that it meets their needs and culturally appropriate for them as well. So we really need to ensure that we are providing information for our patients that's understandable and easy to read. The people who provide the healthcare, they need to confirm that patients understand the information we're providing for them, maybe using the teach-back method. Provide person-centered care that meets the needs of health consumers and complete health literacy training. So that's something important to do. Places where healthcare is provided, it also can play a big role in patient success in their treatment. It needs to be easily accessible and easy to find, where they also have policies and systems in place to encourage health literacy and have leaders advocate for health literacy. All of this will provide a good environment for patient success in their therapy. So as I said, literacy is not the same as education. Some patients may be highly educated in certain, they have degrees, they went to college, but not everyone have the actual knowledge that in the medical field and medications. So that's why keep in mind that, and not necessarily if somebody have a high degree, that means they should be able to understand and follow prescriptions and understand medication therapy. So that's why effective communication should also include avoidance of stereotyping. We should not be overestimating patients' knowledge and literacy or underestimating. And we need to also identify educational resources and methods of communication that would make it easy for our patients to minimize the burden of health literacy. With nearly half of our patients having low literacy nationwide, it is essential for us to understand health literacy and acknowledge this problem and really practice and keep that in mind when we are about to provide the patient education for our patients. So I want to kind of give you a patient case and maybe discuss it for a little bit. FM is a 75 female, was recently discharged from the hospital. Patient stated that all of her medications are new. She used to take only one over-the-counter medication when she needed to. She was found to have a deep vein thrombosis or a clot during her hospital admission and coronary artery disease, where she started new medication. So the new medications that we have here, apixaban, 5 milligrams twice a day. This is a blood thinner, anticoagulant. Atorvastatin, 80 milligrams daily at bedtime. Metoprolol, 25 milligrams twice a day. Lisinopril, 10 milligrams once a day. Aspirin, 81 milligrams once a day. Some of her social background is this is the patient with English as her second language. She wears hearing aids and she lives with her son. She's at your pharmacy trying to buy these medications. She's anxious, crying, and overwhelmed. So I would like to engage you in my discussion today to get have maybe in your chat box. So what do you think we could, from this case, what education barriers you recognize? So if you're gonna maybe type in something in the chat box, that's so we can share it with you. I'm gonna go back to the case so everybody can see what's going on. So this patient, she's 75 years old, female, has new medication, and based on her social history, what do you think barriers for patients that you can address during your counseling session? I don't see anybody typing, but things, okay. Sounds good, yes, Carson Hijazi. Patient doesn't know what each medication is used for, so she may not adhere to take them. Right, yes. That's a very important thing to mention to patients. Akriti Dakal from Nepal. She hearing aids, language barriers, and her age. She might be forgetful. Perfect, exactly. Renad, saying that patient is anxious and having hearing difficulty. Perfect. Yes, exactly. Very good thought. Amazing. Thank you, everyone, for sharing your thoughts. Exactly. The patient is elderly. She does have multiple medications that are new to her. So she could have some, it would be difficult for her to understand and maybe remember all of these medications, how to take them. She does have multiple social issues in terms of English is her second language. So imagining that this patient is living in a place where most speakers are English speakers, so it will be difficult a little bit to communicate. And she does wear a hearing aid. So imagining like in terms of you providing for the patient a counseling session, what environment what do you need to do to make sure this patient is comfortable? She's anxious, so what do we need to do to calm her down? And so she will be able to listen to you and hopefully leave your pharmacy with a better outcome. So when you are trying to provide an effective patient education session, it's important. We all know that if the patient is coming to your pharmacy in a retail environment, it can be noisy and it can be very, so many things going on at the same time. So it is important to pay attention to the environment around you and make sure that you're providing the patient with a quiet place and a place where that she can feel comfortable talking to you. So dealing with privacy and making sure that this patient, so for example, our patient today, she has hearing aids, so she may not be able to, if you are in a noisy environment, so it is important to go to a quiet place, so she will be able to hear you better. Introduction. So it is important that you're introducing yourself to the patient during the patient's education, who you are, what you do, and how long this session will be taking when you're talking to your patient. You need to break the ice between you and the patient. Be friendly and compassionate, and make sure that assure the patient that you understand what they're going through and you are here to help them. And this is a very important way to break the ice between you and the patient, to make the patient comfortable talking to you and ask you questions at the end of your counseling, and making sure that they are understanding and they are part of their healthcare plan. When you are asking the patient questions about their understanding about their medication, or in general, any question, you definitely need to use open-ended questions. What I mean by that is that ask the question, what do they know about their medications? What do the doctor tell them this medication is for? So using open-ended questions will give the patient a chance to answer you for more than yes and no answer. They will answer you with questions and more detailed information than just a yes and no. So instead of telling them, did the doctor tell you lisinopril is for hypertension? Instead, you can say, what did the doctor tell you this medication is for? And have the patient respond. They either tell you, well, the doctor didn't tell me anything, or the doctor told me that these medications can help with lowering my blood pressure. So it will open a conversation. You don't want to have the patient to answer just yes and no. You need to assess their knowledge. Some patients do have a good base knowledge about their medication. So ask the patient, do you know what these medications are for? Have anybody talked to you about these medications? Assess their knowledge, know where they're at, and then go from there. And because it's important to acknowledge that they're smart, it's important to acknowledge that they are able. You don't want to let them feel that they're disabled or not able to understand the medication therapy. Acknowledge that they empower them. You need to empower them, give them that trust that they are capable of taking control over their health. Pay attention to body language. So in our most of the time, it's important that you're working in a pharmacy, and it is important when you're talking to a patient, pay attention if it wasn't either an inpatient or an outpatient setting. The attention span for patients usually is very short, meaning that a lot of patients are very busy. They want to go in and out of their store, or they just had so many people coming into the room during that day, and they're just not patient enough to listen to you. So it is important, in addition to once you be friendly and compassionate and show and improve the environment of the discussion, then the patient will be able to stick to your discussion and stick to your counseling session. So it's important to pay attention to their body language. Are they bored of listening to you? Are they involved? So if you notice that this patient is in a hurry and they want to go, make sure that you keep in mind what are the top 3 things that I need the patient to take home as a take-home message to go to home and do. That hopefully will help them have a better chance of achieving their medication goal. When you are providing a patient education, you definitely need to ensure that patients ask patients about allergies. So, and confirm their allergies. What history of allergies do they have? Administration. So talk to the patient how to take their medication. Tell them is it by oral, injectable, how they should be taking this medication. When is the best time to take this medication? Morning, afternoon, with food, without food, and an empty stomach. So this is important thing to mention to the patient. If the patient have any drug interactions or food interactions, so some medications may increase metabolism of certain drugs or decrease metabolism of certain drugs. So talk to the patient about maybe the top 2 or 3 food that can affect their medication, And if you have multiple medications that are filled at the same time, or if you have a patient history, or if you want to ask the patient, do they take any over-the-counter medications or herbals or supplements, that you need to be aware of to help them, or to ask them, to tell them if it will interfere with the therapy or it will increase risk of side effects. What are the most common side effects? So when you are reading about side effects, you will see all these hundreds and hundreds of side effects that are common and not very common. In general, what you want to talk to the patient about, you want to tell them most common side effects. Like what type of GI side effects they could expect to experience. When is the best time to call the doctor? When they should be going to the hospital, at what point? What serious side effects? If it happens, they need to go to the hospital or call the doctor. And how to manage, if they're able to manage at home. Because a lot of time, most of the patients will discontinue medications if they experience side effects that they're unable to manage or unable to explain, or if they're unable to reach the doctor. So a lot of time they will discontinue that medication. So explain to patients the importance of talking to the doctor, communication, and adherence to medication and compliance. Adherence and compliance is definitely important. And also one of the things that you as a pharmacist can do after you provide a counseling session, to call the patient and have a follow-up, call them the next day or two, ask them how do they do. It makes it really improve their adherence. It makes them feel that they are important. And if you show them that you care, they will actually care as well. They will, but there's a higher chance that they will care as well. And also it will open up the floor for any questions that the patient may not have, didn't have at the time of the session. So I would definitely highly recommend that you provide a contact information for your patient. Talk to the patient about barriers of adherence. So if the patient, for example, forget to take their medication at a certain time of the day, what are the best times for them to take their medication? Help the patient to make the time or to make that medication as a routine in their day-to-day, in their everyday life. And hopefully that will increase the chance for them to adhere to the medication. For example, you can tell the patient to take the medication when they're brushing their teeth first thing in the morning. When they're brushing their teeth, they can put the bottle of medication there, take the medication, brush your teeth, and go on and take your breakfast. Or before they go to bed as well. Maybe make it a part of the routine, so it helps them to remember. As well, it is important maybe after you finish the session with them to ask them to do a teach back method. So to ask the patient, can you tell me how to take this medication, and give them a chance to tell you what they understood. And then at that point, you have an opportunity to correct them and help them better understand. And as I said before, call patients and follow up with them. So it's important it's a good business opportunity for your pharmacy, and it's a good professional opportunity for pharmacists to show that you care for your patients. If you have the chance to call the patient and follow up with them, do so, or provide them with your contact information. So the next day or two, if they don't know or if they have other further questions, they can feel free to call you and ask you any questions they want. So going to our session, back to our case. So again, this is a FM. She's a 75-year-old female. Started on new medications. She's overwhelmed, anxious, and crying. She started on 5 new medications: apixaban, that's a blood thinner; atorvastatin, that's her cholesterol medication; metoprolol and lisinopril for blood pressure; and aspirin. We talked about her English language as a English as second language to be a barrier, and for her to understand, and so what we should be doing about that. She wears hearing aids, so looking at the environment, making sure that we are respecting that and going to a different room where the patient doesn't feel more anxious because she doesn't understand you or doesn't hear you, in an environment that could be very noisy. She lives with her son, so she does have some family support. So that's a good thing. So maybe you need to engage her son in her education and in her therapy. So maybe asking the mom or FM about maybe contacting the son, how much they can help her, and so forth. And so I do have questions to the last couple of things I have for you. So I have a couple of questions for you, and maybe it will help you get engaged a little bit more with me. So, what is the best way to ensure patients taking medication at the same time? What do you think? You can ask a neighbor to give patients a medication, or discuss pillbox and an alarm, or C, write down detailed instructions on a form. So in your chat box, what do you think the best answer would be? A, B, or C? So I have Akriti says answer would be B. May Gamal, hi May, she said that it is B. Tamana Islam B. Qasim Hijazi C. C. Good. I have Opinion B. Raju B. Raya B. So the most of the answers are B, and it is B, and B is the correct answer. So B would be the best, having an alarm, set up an alarm or pillbox. There are some pillboxes available as well that can, they do have an alarm on their own. And there are a lot of fancy pillboxes right now, depending on the patient budget. But that's a good tool for patients to use. Especially in our case for our patients, I believe this would be a very important alarm, and putting pills in a pillbox with different times. It will be a good chance. It will increase her chance and confidence in taking control over all of these medications that she started all at the same time. All right. So talking about question 2, side effects. What is the most concerning side effect to mention for patients about lisinopril and apixaban? So I don't know how many of you have already registered for our counseling and we already received cases. We tried to narrow our request from you when you're recording to like certain medications that you want to counsel about for the patient. You definitely have a lot of opportunities to talk to your patients about, but remember you only have 5 minutes to record your video. So you definitely need to narrow the side effects that you want to discuss with the patient. So just for example, what would you want to talk to the patient about lisinopril and apixaban? A, monitor blood pressure since lisinopril can cause hypertension. Monitor side effects like dry cough for lisinopril. Monitor bleeding and bruising for apixaban. Or D, you would talk to all of the above. What would you do? What do you think are side effects for these medications? All right, in the chat box, you can type in A, B, C, or D. Yep, that's good. May Gamal, D, Qasim Hijazi, D. Thank you everyone for your engaging. Renad, thank you. D. Raju Lama, D. Thank you. Manakamana, D. Okay, wonderful. Yes, so the right question is all of them. So as I said, you probably have one or two medications for the patient to talk about in the cases that we provided for you for the competition. So make sure to talk about the top three maybe side effects of each, and when they should be talking to their doctors or call that or go to the hospital if they experience serious side effects. All right, and with this, I would like to conclude my orientation for counseling. Hopefully I gave you maybe a reason why we have this competition for you. It's an opportunity to maybe flourish your skills in talking to your patients, enhance your confidence in talking to a real patient or someone who could be acting about being a patient as well. So I do want to just kind of give you a little bit brief overview about the competition using our booklet. So this booklet is available for everyone to when you register, you should be able to see it on the website for the competition. So it does provide for you clear information about the expectations and what we're looking for. Some information and history about Dr. Usama and IVPN history and story, and what is our philosophy. So I do want to make sure that you want to make it your own. Be creative, make it in a real pharmacy, not a real pharmacy. Limit the video to only 5 minutes. This is an exercise for real life scenario and educating a real patient. You do want to use your time efficiently. Also, one of the things that I want you to be aware of from my experience from previous competitions is that you need to be aware of your language. Like use English only because we do have judges who don't speak Arabic or other languages. So we definitely want you to speak in English and try to avoid any scientific jargon. I hope that everyone knows how to register for the competition. So you can go to the main page of the IVPN.com or IVPNnetwork.com. You will be able to see the registration right in the main page, and you can definitely stay up to date with us. Follow me on Instagram and LinkedIn, and follow Dr. Ahmed as well. We all both have our personal Instagram, and we also have LinkedIn for pages for IVPN patient support and IVPN patient student, LinkedIn and Instagram. And this is how you will get updated on who's going to be a winner and what would be the next step. So once you register, you should be able to receive the cases. Remember, submission closes April 9 so far, and hopefully by then you have a lot of time to record a video. I really want you to make sure that you have a video that's clear and the voice that they don't have noises going on. And unfortunately, if the video is not a good quality and it's not high quality, because we are going to put this online, we won't be able to continue in the competition. So just be aware of that. So we do have 3 recording guidelines and everything, what type of formatting you need. Professional is here and white coat is preferred. The patient can be a volunteer or a real patient, it's your choice. You can submit it through the submission official event. And I also included some other information. Definitely save it as a Google Drive link, and make sure you make the link, you allow us to see it. We have received links before where we weren't able to open, and unfortunately the person did not respond to us, so we canceled that video or that competitor. So I don't want you to lose that chance. So make sure when you are sharing your Google Drive link that you are allowing us to see and edit. And we do have the top 5 will go into one-on-one session through Zoom with the judges. So we're gonna invite the top 5 contestants to sit with us in a one-on-one session that's live, and then we're gonna do a counseling session then. And then the top 3 will be our winners. So I hope that we're gonna have a lot of winners. But unfortunately, we only can choose 3 of them. We're going to provide some prizes. Thank you, Dr. Osama, for being so generous with us. IVPN Academy right now, so they are running so many different sessions and courses that are usually paid. So it costs about $200 to $500 to go to one of the courses. So we will provide you an opportunity to go into any course you choose for free. And these are our judges, and it's an honor for me to work with all of our judges, Ayan, Haneen, Dr. Muna Barakat, from the IVPN student members as well. We do have students, Ahmed Al-Aqad, Fatima Al-Kafir, Zinia, Kawa, and Hafiz Hamza. Everybody is amazing, and I'm very blessed to work with everyone. And I do want to acknowledge and thank our organizations, student organizations from everywhere, EPSF, STIPA, AEPHAR, BCPC, everyone, and from Nepal, from everywhere, from Nigeria. I was blessed to be able to coordinate and collaborate with our great student organizations from everywhere, LPSA, everywhere, to hopefully make this a more international, multinational patient counseling. So with this, I'm done, and I'm open for any questions you have.
Thank you so much, Dr. Shereen, for your presentation. It was really informative, and I believe that everybody listening is please don't say learn continually. There is always something to learn. I believe that participants take something about patient counseling. It is such a broad topic, and we'll keep on learning from experts like you. Just a reminder to our participants, if you have questions, do write them in the chat box, and we'll get right to them. Before we get to the Q&A session, I would like to highlight some few important points that Dr. Shereen mentioned concerning the competition. So we should make sure that the recording of the videos is maximum of 5 minutes, in which we advise to use our time efficiently. Be aware of your language. Like you say, most people, they are bilingual, they speak many languages, so you are advised to speak to one language, preferably English. You're also advised to avoid too much complex jargon in your speaking. And also, for those who haven't registered yet, you find all the information on our IVPN network website. So do go there, go to the IVPN network website. You'll find all the information about the registration. And also, you are advised to save your videos in a Google form. And please make sure you allow the judges to be able to access the video. Otherwise, they won't be able to see it. The top 5 winners, they are going to be called for a one-on-one session with the judges. And finally, we are going to announce the top 3 winners. Okay. Is somebody say they cannot hear? Can you hear me well now?
There's a static in the voice a little bit, I think.
All right. So okay. All right. Let me change this now. If you can hear me now.
Can you hear me now?
Yes.
All right. So, just give me a second.
Thank you so much for Renad and Mai. They are thanking me for the session. I do see there is
All right, so I'm just going to
Whenever you're
recap.
ready, Michelle.
All right, I'm going to recap what Dr. Serene said. Can you hear me well now?
Yes, and there is
All right,
there
perfect.
is, an echo, but it looks fine for me.
Pardon? Okay, so she was advising the participants to use their time efficiently and also to be aware to only use one language, preferably English, and also to avoid complex jargon in their speaking. All the information about the registration is on the IVPN network website. So do go to the website and check all the information about registration. It is going to be closed on the 9th of April. So make sure you are registered before the 9th of April. Also do save your video in the form of a Google form, Google Drive, and make sure you allow the judges to be able to access the video. And then the top 5 participants, they are going to have a scheduled Zoom session, a one-on-one session with the judges. And then finally, there's going to be the top 3 winners, they are going to be announced. All right, so right now I'm going to pass on to the Q&A session. So if you have got questions either for Ahmed or Dr. Serene, do type them in the chat box and we'll surely get to them. All right, so, okay, this one says, what if the pharmacist itself is not well acquainted with sufficient information regarding the patient's condition and drugs used? I think this one is for Dr. Serene concerning patient education.
Well, look up the information. So I hope that we all have some form of access to drug information literature. And so you definitely need to, if you don't know something about the medication itself, look it up and try to find the information you need. If you don't have enough history about the patient, use your skill to ask patients questions about, you know, the things that you want to know. So this is your chance to talk to your patient and ask the patient about their medical history. If there are things that, if you're talking about real life scenarios, for example, you can always call the doctors and get more information about patient medication and history. So it depend on, this is a very broad question, but again, for the purpose of the competition, use whatever information you have available and try to do the best you can in providing a good session that's 5 minutes long.
Okay, thank you so much, Doctor. We have another question here from Bonheur. She says, we know that each drug has its precautions while taking them. Do we have to explain everything to the patient?
Now, for the purpose of the competition, imagining that you only have 5 minutes and you need to talk to your patient about high risk precautions. So things that you, for example, if I'm giving you a blood thinner, what would be a high risk or something for the patient to know about? Would be bleeding and bruising. Maybe there are other things too, but for the purpose of the competition or in the 5 minutes time, you definitely want to limit it to the top, I would say top 3 side effects that you will find in literature to talk to your patients about. Other tips that I highly recommend, if you have resources like Lexicomp, Micromedics, they also have information like patient information, like slips or patient information tips. Maybe use that as your guide. I think they do have good information, good brief information to provide in general for the patient. So you can feel free to use any resource to provide information. Okay, remember, yeah, like the competition, or for the purpose of the competition, it's we don't also look we don't only look at did you provide the patient the information, but how did you provide the information? What techniques did you use? Stuff like that.
All right. We have another question from Islam. I think this one is for Ahmed. He's asking, how do you join IVPN, and does the organization's are the organization's activities carried out online and offline? So Ahmed, this one is for you.
Yeah, okay, so you can just join IVPN network and other listserv by your register on the website. That you will see in the website the listserv that you can choose any listserv that you are passionate about. If you'd like to join the student listserv, you can register in the student listserv. If you'd like to join patient support, you will join the patient support listserv and register on it. So then you will shift it to a Google group. It will be we will be in this group, and we will also send you all the new updates and new events. Also, if you are opening a call for new board members to be with us, you will have the opportunity and the first priority to join the IVPN student listserv. So I answered your question. And regarding the online or offline, our activities only always online, inshallah.
All right, thank you so much, Ahmed. I think we are done with all the questions. And then there's a K Abid. They are asking if we can mention again the name of the website. Thank you, Dua. You can check in the chat box. Dua has mentioned the website of IVPN. Oh, I think we have come to the end of this session. Thank you, Ahmed. Thank you, Dr. Serene, for your amazing presentations. And to our participants, thank you so much for joining us today. I hope to see you joining the IVPN student network. And also, I wish you all the best in the competition, and I hope to see you soon. Have a great day.
Thank you so much.
Can we take a photo, all of us? If anyone can open the camera, so we can take a photo. So who is going to take a photo, Dr. Ahmed or Michelle?
I can take it.
Okay, thank you.
So please, everyone, please open your camera to take this photo. Hello. Where are you?
It's done.
Yeah, I will take it now.
All right.
Okay.
All right. Thank you. Thank you so much.
Thank you, everyone. Good luck.
Thank you, everyone.
Good luck.
Bye-bye.
Bye.